Hello guys, welcome to Mr. Coco's Message Class. So when you go to YouTube, you'll find this channel, Mr. Coco's Message Class. So this channel, what you do is, if you're not a subscriber already, you can click subscribe, and if you like the video, do click the like just below the video. There'll be a button where you can click like, so that at least to support the channel. So this morning, we want to do what we call implant insertion. So there are various types of implants that you can insert. So when you insert these implants, we are really focusing on family planning. So family planning is so broad. So now we just want to focus on the implants that we can try to put. So here with me have Mr. Chibuya, an expert in implants. So he's going to at least aid in this procedure. Then here we've got Mrs. Chibuya. This is the client that we have. So I'm going to implant the or insert the implant for the rods. So here with me are the two types of implants that we have. We have Levoplant. So Levoplant we insert when we insert, we're supposed to insert it. It was supposed to stay for at least 3 years, but it has also two rods or two implants. Then here we have Jadelle. Jadelle is also part of the implants. So Jadelle also stayed there for 5 years. So Jadelle for 5 years, then Levoplant will be there for 3 years. So those are some of the, that's how it looks. This activation and the implant.
Thank you very much.
Maybe turn them so that they see the implant.
So this is the label.
Uh,
Those are the rods.
Yes.
You can see we describe them as the size of these rods are like a matchstick.
Yes.
They are almost the size of the matchstick. Then what is important here before you do anything else is make sure that you check on the expiry date. Can you see? The expiry date is still potent. Okay, that is 2026, February 2026, and this is just 2024 March. Okay, first things first, we have explained the procedure to the patient. Or client, so to say, it's not the patient, but we prefer to use the term client.
Yes.
Yeah. Fine, we've explained everything, we've gotten the consent. Now, next thing we have to do is to prepare the site.
Yes. And then Mr. Chubie, you can also try to show my students maybe the
Wonderful.
what's on the trolley, so that they get to know what we have here.
Wonderful. So I've got the cylinder, the needle here. Second needle. The first one I used for collecting the lignopen there. Then this is a trocar, a Jadelle trocar. It's a Jadelle trocar. Don't mind about the expiry date. It's a Jadelle trocar. And these are the rods, Jadelle rods. There are two. Then this is our cotton wool. This is our Ovidon or iodine. The antiseptic solution we are going to use to clean the site before insertion of our product. So first things first, I'm going to clean the site.
There you go.
There you go. This is the site of insertion. I'm going to clean it in circular motion. Okay. Then I can also dry the site. It's also sterile.
You're supposed to put on a mask, but then due to voice projection,
Voice projection, right?
Yes. Yeah.
There you go. Next, I have to infiltrate my lignopen now. Okay. If I assume this is the site of insertion, I'll go in a bit, like you see. I withdraw a bit, just a tip of a needle. I withdraw a bit to confirm that I've not gone into the tissue, so in the blood vessel. Okay.
So, Mr. Chubia, which location is this?
Okay.
If it's the human arm?
Yeah, it's the human arm. Look at this. May I have the video? If this is the human arm, this is 2 centimeters, 2 centimeters, 2 centimeters, 2 centimeters. Okay? So when I go like this, right? Imagine if I go like this, okay? Then I fold like this, then I go like this. You see, this is the mark, the point we go for.
Fold again.
2 centimeters, 2 centimeters, 2 centimeters, 8 centimeters up the edge here. Okay? We fold like this, then like this. Where this, the smallest finger, that's where you mark.
Okay.
See that?
Mark.
Yeah, you can mark there. This is the point of insertion. Don't come here, don't go down here. You see that? See the alignment? From this point down here.
You can draw.
Yeah. So I shall use this point as a point of insertion. Don't put it on the tricep. It will disappear into the muscles of the triceps. Okay? So two total 8. Like this, forward, bend like this. This is the point of insertion. Not here, but somewhere here. Okay. So let's assume this is the point of insertion where we are. Okay. So I mentioned I'll go a bit, like just a tip, entry point. I will aspirate to confirm if you have not entered the blood vessel. Then about a mu or two. Then I'll go at an angle. Okay. You can see the end of the needle there.
So this is the point of
The end
insertion.
point, yes, point of insertion
Then
there.
gives you this angle.
Right, yes. Then again, I aspirate a bit to make sure I'm not in the vessel. Then as I'm withdrawing the needle, I'm also infiltrating. Can you see the changes there? I'm pushing my regional cane, okay? Just like before I come out, then I can change the direction, okay? Again, I go in. You see?
This way.
Yes, just there. Then again, I try to aspirate. If I confirm I'm not in a blood vessel, I start pushing the plunger, also coming out in an attempt to release the product, that is an anesthetic agent, okay, until there I am, and I'm out. After that, I have to get again gauze or cotton, which is sterile. I come here and start massaging to promote it or to facilitate the absorption of my anesthetic agent. Okay.
So Mr. Chibe, if it's on the arm, how
Yes.
will it appear here? The V.
The V.
Yes.
Fine. That's good.
How will it appear?
Since this is the point, the entry point, it will be like this now. This is where we are demarked. You see now? This is where demarked as the entry point, so it will appear like this.
Okay.
Sorry, our marker is a little bit faint. Yeah, it will make a V like this. This is the entry point, then it will be like this. Okay, here we go. We've palpated, massaged to make sure to facilitate the absorption. Before we start, we always attempt to communicate to the client to tell us how she's feeling. So imagine this is where I would infiltrated first. We made a V shape. Since all this area we've swabbed it, we try to test it to ask the patient how she's feeling. I want her to differentiate how she's feeling here where there is no anesthetic agent and around the areas where you have infiltrated. Okay, so the patient, they will tell you to say here she can feel full sensation. Here she can feel like not pain as per se, but she can just feel like some numbness. Okay, some numbness because of the product that we've infiltrated. So once she confirms to say there's a difference between here and where we've infiltrated. Next thing we have now to prepare. We have to prepare our Jadelle. Okay, our Jadelle rods. So this is how we open our Jadelle rods. Don't open completely, just up to somewhere there where you can easily pick them. Next, the trocar. That's the trocar. Okay, that's the trocar. You can remove the trocar. You can see the trocar has got some markings. You go 30 degrees, like you're putting up the cannula. The principle is the same with that of putting up a cannula. You go at 30 degrees Celsius, degrees angle, until this mark corresponds with the level of the skin. Okay, so here we go. Let's come here. So we are going like, have you seen this angle I've made? We are going, of course, make sure at this other end, the proximal part of the insertion site, you pull it so that the skin is tented. Right? You maintain the tension. Okay? So look at this, I'm maintaining the tension because if I leave it like this, the skin will be moving to the other end. So I maintain the tension from this base. So I go like, yes, I go like at an angle 30 degrees. Imagine I'm going in until at 30 degrees. Okay? Then I can change like this. Okay? Then I keep going. I keep going, keep going until this other mark corresponds to the level of the skin. You can see?
Okay, so it has disappeared at the point of
Everything has
entry.
gone inside. That mark is there. You can see it. Let it correspond like that. You see now? Next, we remove the introducer. Introducing rod. Then we go and pick the rods. Make sure you show this rod to the client. Madam, that's the first rod. Okay? There it goes. You see? Get the rod once again, introducer, push it in like that. Okay, keep on pushing until you feel there is resistance. Keep on pushing until you feel resistance. Okay, keep on pushing until you feel resistance. Already I can feel resistance here. Once I feel resistance, the next step you are going to do is hold this one static. Don't push any further, just hold it. Since you have felt resistance, hold it static, then start withdrawing. You see now? This one static, hold static, this one I'm withdrawing. You see now? Until that line is seen. You can see? Change the direction, change the angle. Okay? That one, that rod should remain there. Then we change the angle. Go in, go in, go in. We target this one to come and correspond with the level of the skin. You see? There we are. Once again, remove the introducer. Get the second rod, show it to the client,
And put
insert it there, get the introducing rod, keep pushing until you feel resistance. You can see there's a resistance. Hold static, start withdrawing. Start withdrawing, start withdrawing. After you reach this stage, get the cotton swab or gauze, press on the insertion point and remove everything completely.
wonderful, wonderful.
So the rods are inside now. They are even palpable. You can see one rod here.
It is here.
You can see one rod here. Another rod is here. They have made the V shape.
Okay, there you go.
Yeah. You can see one rod there, one rod the other side. Okay. You even ask the patient, but at times it's better after you dress the insertion site. That's when you can ask the patient to palpate for them, because we don't want if the patient to touch this site. We have not yet dressed it. So once the insertion site is contaminated, we are introducing some infection on the insertion site. So after that, we try to see if there is any bleeding. Of course, you see some bleeding and some fluids coming out because of backflow of the lignocaine that we are doing. If you treated the area, it will start coming out. So clean, 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 clean. Then prepare the dressing like. We prefer to use gauze. Right? But what we have is, but the best to use is gauze. So gauze nicely, press, then you put a small strapping. Okay? We put a small strapping. Can I have a strapping, my assistant there? Small gauze, small strapping, just a very small one. Okay, a small one. We dress. Dressing number one. Second one, another dressing. I will need another strapping. In the absence of the method we are using to dress the insertion site, there are those special plastering kind of stuff which has all the dressings ready attached to the dressing, which you can simply open as a sterile pack and apply. But in this case, where you're using the strapping from this row, you prepare your small gauze, you put first strapping, secondly, then take note that the outermost should be bigger than the outermost strapping should be quite bigger to mask the smaller or initial dressing inside. You get the point?
Yes, we do.
Yeah, so that everything is masked. Imagine this one is protruding up to that end. So you ask now the client to palpate for the rods. So that she confirms to say, indeed, these some rods have been introduced onto under my skin. So that's rod number one, that's rod number two. You instruct the patient to make sure that the outermost dressing is going to be removed after 48 hours. Okay? Today is Friday. She will allow this dressing to remain here. Saturday, Sunday, in the morning, this dressing should be the topmost dressing. Okay? Monday or possibly Tuesday, the innermost dressing should be removed. By then, this small site, it is not a big opening, some kind of, it will just be like a tip where we had inserted the introducer, the trocar. It will just be like a small spot. By the third, fourth day, it will close completely. It will just remain like a dot kind of. Then, first week or 2 weeks, we always advise that our clients should avoid lifting heavy things. You go and fetch some water from the well, lifting everything. We want that area first to at least close up completely. Then she can now start attending to heavy duty kind of work. I think that's all.
Okay. So meaning that this part here, as well elaborated, this part is this here. Okay. So this has been elaborated nicely. So this is how we insert these implants. Okay. So I'm sure you have learned now the B kind of insertion. So I'm sure you should just be there to at least assist or be trained so that you can be able to insert the implants. So like you have read the IEC, you're supposed to give it to the client.
Very important. Yes.
Very important. No lifting heavy things. They have to keep the area clean and all that, so that the implant should be there in situ. So like you are going to see in the video for removal, sometimes these implants can disappear into the muscle or into the tissues. So like in the video, which we have, the one implant disappeared there, but we had to locate it later on. It was removed. So that's what happens there. So you need to give at least more IEC to the client because they're not going to give birth. They're not going to be pregnant. So at that particular period, they have to understand that they're not going to be pregnant. So thank you very much, Mr. Chigwe.
You're most welcome.
And thank you very much, Edwin, for the video. Okay, and keep watching, subscribe, and click like. Thank you very much.